just check that you can share your slides with us, Stuart?
Sure.
Before I...
How's that?
Perfect. So getting a little bit unnerving saying Stuart when it's normally Stu.
Yeah.
Okay.
Stu's fine. Everybody calls me Stu.
Yeah. Well, I heard the other night, actually, I won't mention names, that if you're not happy with someone, you actually use your full name. So if you're writing an email, you so I'm not sure whether I've had that response from you, but yeah. I know what to look out for in future. Okay, there are just a few more people joining. I'll just give them a couple more minutes rather than me having to try and get them in. So welcome, everyone. Good afternoon or good evening, depending on where you are in the world. Hope you're all well and staying safe during these kind of strange and difficult times. For those that are not aware or familiar with me, I'm Richard Mackenzie. I'm based at Roehampton University in London, and I rather stupidly decided to host a series of talks on integrative human nutrition and exercise physiology during a period where I am busier than I probably was before lockdown. But that said, we have managed to secure some excellent speakers on this series, and today we're joined by Professor Stuart Phillips from McMaster's University. Now, within the area of muscle protein synthesis and nutrition, Stuart really does not need any introductions. Indeed, we could probably spend the next sort of hour discussing his many contributions to the field, but I will keep his introduction relatively short because I'm sure the audience really want to listen to you, Stu, and not me waffle on. But I think it's worth highlighting a few things. One thing that always strikes me is that Stuart's produced a number of great PhD graduates over the years, and they've gone on to establish their own labs and contribute to the field greatly. He has over 120 peer-reviewed journal papers in the area of nutrition and exercise on human protein turnover. With that number growing, it seems almost weekly. He was also awarded a great prize, the Ontario Premier Research Excellence Award, and is director for the Physical Activity Centre for Excellence and director of McMaster's Centre for Nutrition and Exercise and Health Research. So just before I pass you over to Stu, I'd like to ask anyone that's just joined us to keep their audio on mute during the conversation, during the talk, I should say. And if you have any questions, please post them on the chat feature on Zoom, and I will try and get those across to Stuart should we have enough time. So without further ado, Stuart, I'd like to pass over to yourself.
Super. Well, thanks very much, Richard, and thanks everybody for joining us well at noon my time, so it must be 5 in somewhere 6 o'clock in most of Europe, or maybe it's earlier for some people. Yeah, just exactly what Richard said. First things first, I hope everybody's safe and well and staying that way. Definitely unprecedented events, but so here we are. This is my living room or my new office, and probably a lot like Richard, a lot like a lot of you, all of a sudden different requests for these types of things, but a really unique time to take advantage of people being able to do this sort of thing. So I thought what I would do is give you sort of a tour de force of some of the things that we've done in the past, and maybe make a few new points, and then tell you a few directions that we're going in the future. So the title is rather loose, and hopefully for some of you there's something new in here. So before we get started, just really important for me to acknowledge the people who really do the work, and those are the graduate students and postdocs, and a fellow named Todd Pryor, who appears in all of these pictures as our lab manager. And you can see there the last 3 years. Unfortunately, I don't have an up-to-date one, but and a lot of so-called lab alumni, all of whom have gone on to do lots of great things. So really proud to have been involved in these people's careers, and hopefully had a small part in shaping where they are heading. A model of human skeletal muscle hypertrophy that we spend a lot of time discussing in my lab is as follows. We look at extrinsic inputs into the system. We look at intrinsic functions within the system that dictate the function output, which in this case would be hypertrophy. We can look at a lot of different extrinsic variables, dietary protein, supplements like HMB, which I'll discuss today. We can look at training variables like fiber recruitment. We can look at damage. We can look at sets, reps, volume, lots of different things. But it's the functions within the system then that are going to determine the system output. So it ranges from genes and omic variables, protein turnover, satellite cells, blood flow, and probably a lot of other things that I don't have on this slide. The outcomes then that we measure in terms of hypertrophy are generally either intrinsic to the muscle itself that we get from skeletal muscle biopsies, or indirect measures, if you like, of hypertrophy from imaging or scans, and most usually DEXA scan, occasionally MRI, sometimes CT scan, lots of different things like that. But all of these are indices and outcomes that we're interested in. I tell athletes and mere mortals, and I squarely put myself in that category, a few things. So first of all, with respect to protein and exercise, and I borrow heavily from Jack LaLanne, is that exercise is still king, but nutrition is queen, and together they form a kingdom. So what I'm going to talk to you about today is the interaction between these two variables. And I often make the point to people that it's the good stuff, and that is the adaptation that happens in recovery. And in recovery, when I talk to athletes, I talk about 3 R's: rehydrate, refuel, and repair. And repair is the protein aspect of things. And the last point I generally make is that when it comes to protein, all people in general, mere mortals and athletes, could benefit from consuming more than the minimum, which is the RDA. So a lot of the questions that I often get asked, and hopefully will answer by the end of this presentation, fall into the following categories. There's a lot more, but this is what I'm going to talk about today. So first of all, does protein increase muscle gain with resistance training? How much do I need? Are supplements better than real food? Are some protein supplements better than others? And will protein cause my kidneys to fail or my bones to dissolve? And then one of the more specific questions, and that we've had some interest in, is about a leucine-related metabolite called beta-hydroxybeta-methylbutyrate, or HMB. So just a quick crash course in biochemistry here about how muscle mass is regulated, and at least how we see it in our group. And a lot of you have probably seen these curves oscillating backwards and forwards, and really it's 2 variables within the system that determine balance, and that's muscle protein synthesis and muscle protein breakdown. Synthesis, as the analogy goes, is the bricks going into the wall. Breakdown is the bricks coming out of the wall. And obviously more bricks going in, the wall's getting bigger, more bricks coming out, the wall's getting smaller. But in people who are finished growing, so usually by about 18 to 20 years of age, it's about expansion of the wall, where the wall is muscle, and really it's hypertrophy that is the key process. So we wake up in the morning, we consume some protein with breakfast, we get a pronounced stimulation of muscle protein synthesis, we get a small suppression of protein breakdown, and you can see this green area represents then a small area of muscle protein accretion. But we don't eat for a period of time, and then we get this sort of gray area. In other words, breakdown is now greater than synthesis, and clearly what you can see is that synthesis oscillates probably about 4 to 5 times more than breakdown does. In normal healthy people, breakdown really doesn't do anything much. But then we have our lunch, and we go from this gray area of muscle loss to an area of muscle gain, but then we have an area of muscle loss before we eat our dinner time meal, and then we have a further stimulation of muscle protein synthesis. Now, the big gray bubble that's missing from the end of this diagram is the area of muscle protein loss that most of us would experience before or during, when we're sleeping. So with resistance exercise, the message is a little bit different. What happens here when we add this resistive stimulus is that each period after we've eaten a meal is a little bit greater. So you can see the higher amplitude of gain here. And the interesting part is, and contrary to what a lot of people think, in the fasted periods, we actually lose a little bit less. And so that highlights, I think, a number of things about the resistive exercise stimulus. First of all, it's fairly long lasting, as this figure shows. It's at least a day long, and I'll go into that a little bit more. And it's fundamentally anabolic. So the anabolic window, which is what a lot of people are sort of concerned about, is as this figure shows, and it's actually a figure from a review paper a former grad student of mine, Tyler Churchwood-Vinay, wrote, but summarized what we do know, and that is that the window is open for at least 24 and probably up to 48 hours. And just to remind you and to prove to people that I actually did do work, although it was a long time ago directly, this is data from 1997. That, proving to you that good science was done before the millennium rolled around, showing you that up to 48 hours, the fractional synthetic rate, or the FSR on the top figure, is actually stimulated after a significant bout of resistance exercise. So it's not necessary, contrary to what a lot of people believe, to walk around with a shaker bottle of protein to take advantage of this, this anabolic window. And this is sort of a meta-analysis which I like to use to sort of make the point, and it's Brad Schoenfeld and Jim Krieger and Alan Aragon who are responsible for this work. But when you look at this forest plot, you can see down the bottom that the overall effect favors the treatment, or the co-temporal, if you like, ingestion of protein in terms of hypertrophy. But when you make the adjustment for overall daily intake, you can see that the effect is relatively small, or non-existent in this case. So protein timing matters, but it's probably a small variable in terms of actually getting into the gym and doing some weightlifting per se. So I think the take-home point here would be that feeding-induced changes in protein synthesis are enhanced by resistance exercise. Fasted state losses are lower. In other words, resistance exercise is fundamentally anabolic, and the effect is quite long-lasting, probably dependent on the amount of volume of work that these people do. So one of the questions we first set out to ask a number of years ago is that, what is the optimal then amount of protein that stimulates muscle protein synthesis? Remembering, of course, the protein, unlike carbohydrates and fats, doesn't have a storage reservoir. In other words, it has to be used in the immediate period after which it's being ingested. So this is work that's growing a little bit older in the tooth now, but I think it sets the stage to sort of make the point that I'll make a little bit later on about per meal doses. And this is work done by Dan Moore. Dan's now an associate professor at the University of Toronto, but a former PhD student of mine. And what he showed is that at a dose of about 20 grams, that muscle protein synthesis was maximized, and these were young resistance trained men. But we realized, even within the context of this paper, that there had to be some variability in this. In other words, if you were a smaller individual than the average, which in this case was about, I think, 85, 86 kilos, or if you were a bigger individual, you'd obviously require more. An absolute amount of protein probably, as most people realize, makes little sense to talk about. We even talk about the RDA in terms of grams of protein per kilogram body mass. But clearly, there's a range here, but it nets out at about 0.25 grams of protein per kilogram per meal. And the protein source in this study was isolated egg protein. So from this study, we concluded 20 grams of protein, or about a quarter gram of protein per kilo per meal, maximally stimulates muscle protein synthesis after exercise. We went for, fast forward a number of years now to 2015 and did a retrospective analysis with data from our lab and data from Kevin Tipton and Ollie Wittard when they were both at Sterling University, looking back at the rate of myofibrillar fractional protein synthesis, and conducted this breakpoint analysis. So really what we're looking for is an inflection in two curves that are linear, one which describes the upsweep and then one which describes the plateau. The inflection point then plus about a 95% confidence interval. You can see there could be as low as 0.18 or as high as 0.3, but it comes out at about the same amount. So this is data from about 6 different studies, but basically recapitulating what Dan found in 2009. The interesting part, and really the point for doing this study, was to show you that the curve on the left from young men versus the curve on the right from older men obviously have different inflection points, and it's shifted to the right. And this describes the, I think now, well-documented phenomenon. People like Blake Rasmussen and Luc Van Loon have also shown this, of anabolic resistance as we get a little bit older. One of the things that I think is important to mention would be that the inflection point in the young individuals versus the older individuals is shifted to the right, and that would be important with respect to the per dose, which is obviously higher for older individuals versus younger individuals. Getting a message over here. Sorry, I can't see that. I'm getting old. Yes, those are the old individuals on the right-hand side. Whoever that was, well done. So it's interesting that these older individuals have a higher per meal requirement. It's almost 70% higher than young individuals. And so what we're looking at then is a situation of this anabolic resistance in muscle protein synthesis, where older individuals, in response to the same protein containing meals, would have a relatively, if you like, muted response. And then we think that this is one of the main reasons why older people lose muscle mass and obviously have a greater requirement for protein. One of the interesting questions then is, what can we do about this longest period of muscle loss, which is when we're sleeping? And some interesting data that almost the majority of which has come out of Luc Van Loon's lab. It was presented a few years ago by Tim Snyders, and this is his study basically showing that younger men who received a protein dose prior to going to sleep during 12 weeks of resistance training were able to see a greater hypertrophic response, which you can see in the protein dose here, that interestingly enough, and there's Tim on the right, interestingly enough resulted in a greater increase in strength when you summed all of the 1RMs together. I know a lot of people are critical of this study because the placebo group didn't get the same amount of protein, but I'm quick to point out that the protein dose in this study was only about an extra, I think, 25 to 30 grams of protein per day, which is impressive that it did have the effects that it did. And I think that it's probably more related to the timing, but clearly some more work to be done in this area. So it sort of led us to propose this sort of modified protein feeding pattern where we talk to athletes who might train once in the morning or once in the afternoon, and then before they go to sleep of something like this. So we're talking about 4 protein containing meals in a day. We don't think you can consume more because the system, for reasons that we're not fully aware of, but probably related to what Phil Atherton's group has called the muscle full effect, that you can't really stimulate the system too many times in a day. So we talk about 4 protein containing meals spaced around workouts. And clearly the one that with respect to pre-sleep is to alleviate this sort of big gray bubble before the end of the day. So a larger protein containing meal at that time would be, I think, recommended. And that's what the Snyders work definitely shows. So, and we get this sort of anabolic response if you do consume that meal. So offsetting some of that negative overnight, if you like, catabolic state. So protein recommendations to maximize hypertrophy would sort of look something like this. We're going to make them first for 4 equally spaced protein containing meals. I've gone to the higher end of the per meal dose of about 0.3. If you want to go higher, I don't have any problem with that. I think that you can probably see later on that there's an upper limit and which we'll talk about. We have one larger pre-sleep meal at about 0.5 grams per kilo per day. So for 120 kilogram male American football, gridiron football, so big people, then you're talking about 204 grams of protein per day, or about 1.7 grams per kilo per day. But you can scale this down, and we could talk about for a 50 kilogram female cross-country runner. And in this situation, then this person would be consuming only 15 grams in the daytime meals, have a 25 gram pre-sleep meal, and add up to about 1.7 grams per kilo per day, but obviously much less protein. But clearly, dose and meal spacing are important. If you get less than the 36 or less than the 15 grams for these two athletes, then you wouldn't hit the theoretical ceiling for stimulating muscle protein synthesis. And I don't think you can stack one meal on top of the other. How important it is to space these apart and what amount of time, I think is a question for sort of further discussion. But most of the research that at least that's available would suggest that you can probably get 3 feeds in, maybe 4, and that the pre-sleep meal would be something that I think is pragmatic. I fully admit that in talking to athletes and people that use this as a strategy, some people think it's fantastic and they have no problem with it. Other people don't like it. They don't sleep well. So it's a very person-specific recommendation. So what's the real active acid, or excuse me, amino acid in the mix here? And obviously we know that there are 20 amino acids, 9 are essential. We can argue about conditional essentiality for some of them, but the majority of work has shown that you can mount a full and robust anabolic response just by giving people essential amino acids. And it's probably no surprise to anybody that the amino acid leucine then occupies this position of prominence. It's a branched chain amino acid. It stimulates essentially important protein called mTOR. There's a structure. There's the pathways that we're talking about. And even now we have, through the work of David Sabatini's lab at MIT, we have a good idea of the mechanism of how this works by inhibiting a protein called cestrin-2. I think it's really important for people to realize that, you know, studies have been done, and this was a collaborative group, a collaborative effort between Phil Atherton's group and our group, showing that giving the individual amino acid leucine alone and its metabolic cousin HMB, it makes it potent stimulation for muscle protein synthesis. So you don't necessarily even need all of the other essential amino acids, but obviously this is going to be a transient effect because at some point you can turn the process of protein synthesis on, but you have to have all of the other essential amino acids to make the process continue. But just to emphasize again, and this is work that that Phil did when he was working with the late Mike Rennie, just to show you that this is in C2C12 cells, that leucine in and of itself is the one essential amino acid, not the properties to stimulate all of the key proteins in this pathway don't belong to some of the other amino acids, but it's the one that really stands over and above the rest. So this is a study that Tyler Churchward-Vinay, there he is, he was a former PhD student in our group, did to sort of illustrate that even if the dose response data are correct, to show you that a small dose of whey protein can be made to be equivalent to a larger dose of whey protein simply by adding back leucine. So the negative control in this situation would be the small dose, 6 grams of whey. The positive control would be the 25-gram dose. And then we've got the intervention doses, which is the 6 gram of whey with 5 grams of leucine. Clearly, you can see that, I mean, this appeared in 2013. I would probably fully agree that 5 grams of leucine is more than you need. So we're going over the top here, but trying to conduct a proof of principle and show you that the muscle protein synthetic response in the early period is the same between all of the conditions, but the continued stimulation of protein synthesis only happens in the 25-gram whey group, and also then in the 6 gram of whey plus 5 gram of leucine group. So you can make a dose of whey that is almost 1/4 the size appear the same as a much larger dose of whey protein, simply by adding back leucine. To show you that the effect isn't transient, this is work from Keelan Murphy. So fast forward a few more years, but 2016 when it appeared. And Keelan, what she showed here is that it doesn't matter whether you're consuming a lower, in other words, the RDA, or a higher protein containing diet. And this is an older man. And we've shifted methodology here to point out to you that this is integrated protein synthesis over an entire 5-day period, and that leucine stimulates muscle protein synthesis over that period of time at rest. This was an addition to 5 grams of leucine at each meal, and it works even in a resistance exercise situation. So on the right-hand side, you can see resistance exercise here stimulates muscle protein synthesis, as it always does, but the leucine supplemented group appeared to get an even further boost in muscle protein synthesis. Again, taking one step further forward, this is work by Michaela DeVries, former postdoc in our group, showing that the same is true in older women. Although this time we integrated the leucine within the same dose of protein. So all of these women were consuming 1 gram of protein per kilo per day, and yet in the rested condition, those that consumed a higher leucine got a stimulation of protein synthesis, and those that were conducting exercise, actually we did a unilateral model, so everybody was doing both. You can see that again, resistance exercise stimulates protein synthesis, but if you're getting a higher leucine diet, it stimulates it even further. So it's led us, and it's not necessarily our work that leads us to propose this model, but a number of other labs, clearly Luc Van Loon and Blake Rasmussen, as well as Phil Atherton's group, are in on this, and then a lot of other molecular groups are showing us the proposed mechanisms. This so-called leucine trigger hypothesis. So we've got a graph here showing the intracellular concentration of leucine with a low, a moderate, and a high dose of, it could be a leucine-containing protein or leucine in and of itself. And then this trigger threshold here would indicate that the intracellular leucine concentration really has to get up and saturate the process of inhibiting cestrin 2 to stimulate a robust muscle protein synthetic response. Now, it's not probably a trigger, an on-off switch, but more like a dimmer switch that goes, if you like, somewhat lit up to all the way lit up. But what we do know is that if you're active and engaging in resistance exercise, that this trigger, at least transiently, comes down lower. So you can make use then of lower doses of leucine or lower doses of protein to get the same anabolic response. But if you're inactive, if you're a little bit older, if you're type 2 diabetic, if you're on bed rest, or if you have a leg that's immobilized, this leucine trigger actually gets higher. In other words, the muscle is desensitized, and you have to either do some exercise or do some physical activity, or have some type of muscle loading stimulus, or consume more leucine. And this is just to remind people that not all proteins are created equal. And this is something called the leucine amino acid reference ratio in a number of isolated protein sources. And we've got the W's are whey, and we've got protein isolate and protein concentrate. And we've got soy protein isolate, 2 different forms. We've got pea protein concentrate, rice protein concentrate, and collagen. And if you think about leucine then being the essential amino acid that is going to stimulate protein synthesis, you'd have to consume, as this suggests, 4 times more collagen or twice as much soy to get up to the same leucine content to trigger that response. However, just bearing in mind that if you're physically active, that even some of these lower quality proteins could probably do the job. The question you probably ask yourself at this point with respect to muscle protein synthesis is, does any or all of this matter? And I'm a master faculty member, so as a card-carrying McMaster person, I have to talk about evidence-based medicine or evidence-based science at some point. So this is a meta-analysis done by a former PhD student, Rob Morton, from our lab that appeared in the British Journal of Sports Medicine. And what we did in this was to look at all the literature that was available, at least in meta-inclusion criteria, as to old and younger people that were engaging in resistance training and either had some type of protein supplement or some type of dietary intervention to increase protein intake, and then were engaging in resistance exercise. So, you know, after you basically do all of the work to shake this through, we ended up with 49 randomized controlled trials encompassing a total of about 1,863 individuals, and this is what we found. This is the effect that protein supplementation has on augmenting gains in 1 repetition max strength in a lift that was consistent across all of these studies. The immediate thing that probably jumps out to most people, we've got a lot more studies in untrained individuals and a lot less in trained. Maybe contrary to what a lot of people might think, however, it's in the trained individuals in whom we see the augmentative effects of protein supplementation. In the untrained individuals, the effect actually isn't significant, but overall, you can see the black rhombus down at the bottom of this figure on this forest plot showing, and it looks like it's touching the line, but I can promise you it's not. So it is a significant effect, but I'll show you what that means in real life, but it's relatively small. At the same time, then, the question is what happens with respect to hypertrophy or muscle mass gain, fat bone-free mass or fat-free mass, whichever you want to choose. And I think the gain that would probably surprise a lot of people to realize that the significant effect really from this meta-analysis comes when you look at trained versus untrained individuals. And you can see that the rhombus is off to the right. And so it does favor protein supplementation. But when you look at the magnitude of the effect, it's relatively small. This was an attempt then to use the same segmental, what we call segmental linear regression analysis that you've seen previously with the dose response at the total dietary protein intake, beyond which further gains in fat-free mass did not occur. In other words, you could supplement people upwards of 3 and even 4, and I've seen higher doses of protein, grams per kilo per day. And my point would be is that at some point the muscle becomes saturated. You simply can't put protein away in muscle or in other places for that matter for it to be available for use at a later period of time. What you could immediately see from this graph is that the inflection point occurs around 1.6 grams of protein per kilo per day. The 90% confidence interval extends down as low as 1 and as high as 2.2. If you want to call the 2.2 the upper limit or a margin for error, I have no issue with that. I think much to the joy of a lot of people involved in resistance training, 2.2 grams per kilo comes out at 1 gram per pound, which is what a lot of people have said should be the target for years and years now. So the math worked out conveniently, and a lot of people jadedly said all that science had done here was verify what a lot of people in the gym had been saying. So I got a chuckle out of that one. It's glad that science could back up some of what you've heard in the gym. I think the interesting point, though, is that this relationship, and we must have snuck one past the reviewers here, is actually not even statistically significant. So I like using the numbers, but I will admit that it's something that is somewhat tenuous. But so with that in mind, I talk about 1.6 as being the upper intake, and beyond that, my thinking is that you get less and less back for more and more protein. So you've probably got 95+% of the job done with about 1.6, still twice as high as the RDA. This is what the augmentative effects look like, and this is the total sum population, 1,800 odd individuals, what it means in real life. So sometimes the forest plots are somewhat confusing, but what we've done here is tried to show you the benefit with 1RM in the left-hand, if you like, column, and it's about 9%. So that's not a big change, and I know a lot of people will want to say, but that could be the difference between first place and either second or maybe even 10th place. In elite people, my point would be is that obviously nobody in these studies were elite. So I think that's an interesting argument to make. I just not sure that it's overly valid as to its importance. The augmentation of lean mass, and you can see in 1,800 some odd individuals, you get about a kilo of lean mass with about 13 to 14 weeks of resistance training is an extra 270 odd grams, so 27%. Maybe that's a big deal to some people, but it does show you that the majority of the effect is gained by simply going to the gym and lifting weights, and that the effect of protein on top of that is relatively small. So some important takeaway points from this meta-analysis. First of all, dietary protein supplementation does augment changes in fat-free mass or muscle mass, and it does augment changes in strength, and those are substantial p-values, but ones that you can only obtain when you end up analyzing as many people as we did. Dietary protein supplementation is more effective in resistance-trained individuals, and while I didn't show it here, it is less effective in older individuals. So it begs the question of how high you would need to go to show this augmentive effect in older individuals, and my guess is that it's probably as high as at least 1.6 and maybe even a little bit higher, or you have to use very high quality protein. Protein supplementation beyond a total intake of about 1.6, if you want to do the math and divide it into 4, that's about 4 times 0.4 grams per kilo per meal. If you want to divide it into 3, I think that's also applicable, and it's about 0.53 grams of protein per kilogram per meal. But there's no really, I think, substantial benefit beyond that intake. So it's a series of diminishing returns, but we clearly need some more work done in that area to get a definitive answer. I'm going to finish off with a little bit of this section of the talk with a little bit of protein mythology, and just to sort of, it's almost a public service announcement to talk about what protein will not do. Clearly, the biggest bugaboo here is that protein is supposedly a causative agent in kidney function. And I'll just give you my sort of 10 cents or 2 cents or however much, 5 euros or however many pennies. There are no data that causatively or even associatively link higher protein diets to renal disease. Now, you don't have to take my word for this, even though the literature supports it. But the FAO and the WHO report says this. So does the Institute of Medicine report that sets the DRI for North Americans. And the quotes are here. In the most recent round of discussions in setting the new dietary reference intakes, the Institute of Medicine concluded protein content of the diet is not related to decline in kidney function with age. Similarly, from the WHO FAO report, skipping over the first part, but simply increasing protein content and the decline that occurs with age, the idea that it can be attenuated by reducing protein in the diet has no foundation. So, where did this come from? It's an old hypothesis, probably about 40 years old, put forth by Brenner, works very well in animals. Observational data in humans would appear to back this up, but it goes something like this. People with chronic kidney disease and renal failure are put on low protein diets. We know through clinical investigations that this prolongs their life, mainly because it reduces solute load that the kidney has to deal with, and so reduces the work of the kidney and prolongs kidney function. The circular logic then that takes place is that therefore higher protein diets caused renal disease, and that of course is incorrect, and where a lot of this falls down. You can look up this meta-analysis. There's another one by a woman named Mary Van Elswyk that came out the same year, and you can actually get a causative answer because that's what an intervention trial does. It allows you to say one does not cause the other, and we were unable to find the causative link between these two things. There's a lot of observational data that people would argue obviously is in the wrong direction, is that it does, but observation is not causative. It's low quality evidence, and even that there's a sort of scant data when you go and look in the literature. The last thing I want to talk about, it's not my work, but a lot of people want to talk about how protein causes a decline in blood pH because of an acid-ash effect, and that then dissolves bones. And what I just want to sort of put forward here is that if anything, protein is a bone supportive nutrient. It's probably a news flash for a number of people. That almost 40% of most people's bone content is actually protein, it's collagen. And when consumed in sufficient quantities with adequate calcium and adequate vitamin D, then it's a bone supportive nutrient. And so there are lots of meta-analyses done on this, and it's not my work, so I don't want to confuse too many people. But again, public service announcement, not a big deal in my opinion. The last part and what I want to talk about is about beta-hydroxy beta-methylbutyrate. And this came to our attention basically because there's these 3 studies here, reported muscle gain or fat bone free mass or fat free mass, whatever you want to use, that was substantially greater than has been reported by, well, our meta-analysis, for example, where we had a lot of people. And it really sort of cried out to us to say, if this metabolite, which is a metabolite of leucine, is so potent, there really must be something substantial to it. So we need to do some of our own work, because as an extrinsic variable, something this important and this potent would be on the range, I would say, probably close to an anabolic steroid. So that's really what triggered our work in this area. So this is a graphic credit to a young man named Joseph Agu, who lives in the United Kingdom, and I believe is an instructor at Nottingham University. And he put it in some perspective here that the study on the far left, if you don't know it, is a study by a guy named Shilander Bassine, appeared in the New England Journal in 1996, and really hinted to the fact that, this is 600 milligrams of testosterone and enanthate with 10 weeks of resistance training, that, to me, that's the upper bound of what most people can gain in terms of muscle mass. So that was about 6 kilos by DEXA. So then we have an ATP study, which showed 4 kilos in 12 weeks. We have an HMB free acid study, which is almost 7 kilos in 12 weeks. And then we have the ATP plus HMB free acid, which is pushing 8 kilograms in 12 weeks. And then I've just added the Kramer paper here, which is actually 9 kilograms of fat bone free mass in the same period. And what you'll notice again is that Joseph has put the fat mass loss at the same time, which is actually equally impressive on the range of something like sibutramine or an obviously pronounced dietary restriction. So, this is leucine on the right-hand side of your screen, beta-hydroxymethylbutyrate on the left. Take the keto acid of leucine, which is ketoisocaproic acid, and then decarboxylate it, and that's what you get. It comes in 2 forms, as a calcium salt or a free acid. Ostensibly, the free acid is more bioavailable, but this is to show you the effect of leucine, which is in the dots here, the free acid in the orange, and the calcium salt in the blue. These are data all from Phil Atherton's lab. I showed you some of the collaborative work we did with them with the leucine here, but just that they basically lay right on top of each other in terms of relative percent stimulation. This is the lean mass gain in the Kramer study, just again to show you that it's around 9 kilos. I think that probably stands out as one of the biggest that we can see in and I've done a little bit of the metric math there for you. 1 kilo is 2.2 pounds. I'd be more than proud of this if this happened in any subject we'd ever tested in the entire 23 years that I've been at McMaster University over a period of 12 weeks. So just to sort of give you some comparative sense, this is the Wilson data and the Lowry data, and this is from the Morton meta-analysis, again, 624 individuals. Simply put, the range that we see here, and I've just given it to you again, between 1.2 and 1.6 compared to 7.4 and 8.5 really sort of set us off to say, you know, what is going on here? Is this really something that's happening? So what we wanted to do was a protocol using the exact same protocol that was used by Kramer, Lowry, and Wilson, and give people HMB times 2, so a 1.5 dose times 2, so the 3-gram dose that's been used in other protocol. We combined it with a protein drink because, you know, at our hands, that's also an anabolic supplement, and we showed not a big one. And we just compared it head-to-head to leucine because most times HMB is being compared to maltodextrin, or basically a carbohydrate filler. So 13 individuals should be more than sufficient given that the Lowry and Wilson studies and the Kramer studies showed it with less. So we thought we were sufficiently powered. And basically what we did was base the supplement around the training and before sleep on the training days, and then obviously twice during the day on the non-training days. Here's the design. It was an undulating periodized resistance training program designed to match exactly what had been used in those previous studies. We did a few different things here. We didn't do just DEXA. We took muscle biopsies. We did frequent strength testing. We took hormonal profiles and did all of the strength testing the same as the other protocols have done. There's our two groups just to show you that there's no difference between them at baseline. And to make the point that their protein intake in terms of grams per kilo per day was well above what you would probably need to maximize hypertrophic gains. This is what we found with respect to the two groups in terms of the changes in fat bone free mass from DEXA. So you've got the whey plus HMB in white, and then the whey plus leucine in gray, and you can see immediately that there were no difference between the two groups. These are all box and whisker plots, so a minimum and a maximum, an interquartile range in the box. The mean is the cross, and the median is the line inside the box. These are the gains in muscle thickness. If you use ultrasound, I like to use that. We've got thickness on the left, and we've got muscle cross-sectional area. In this case is the vastus lateralis. And the clear take-home point here is there's no difference between the two groups. So whey plus HMB and whey plus leucine experience similar increases in lean body mass, muscle thickness, muscle cross-sectional area, and strength, albeit strength misspelled at the end there. My apologies. We saw similar gains in strength. There's the total 1RM strength across 4 different lifts. Everybody got stronger. Nobody won the race. If anything, the whey plus leucine group appeared to do a little bit better. Similar strength gains. And it's interesting when you lay the increase in fat bone free mass across the course of the study out. And what we saw, or what we didn't see, was that after the undulating periodized portion and an intensified 2-week portion, there was a taper. And during the taper is really where the Lowry, Wilson, and Kramer subjects kind of took off, and we just did not see that. So the change in lean mass, as you can see over the course of the study, and the change in total strength in our whey and our whey plus leucine groups actually resembled much more the change in the HMB groups in the Wilson and Lowry paper, similarly the Kramer paper. And we didn't get this sort of suppressed gain in the placebo group. And you can see there, it's almost a third to almost a quarter in the Lowry and Wilson studies. And we didn't find that at all. So I don't know what's going on. So with respect to the protein questions, I'll give you the take-home points. Hopefully I've convinced you when it comes to does protein increase muscle mass gain with resistance training? The answer is yes. It's a good, I think, signal, but it's relatively small. How much protein do I need? We could quibble over a per meal protein dose, but somewhere in the range of 0.3 to 0.5. Intakes summing up to around 1.6, maybe up to 2.2, and I think that's a decent signal. There's nothing to suggest that beyond this 1 gram per pound is really necessary. People want to talk about, you know, what happens in a caloric deficit, and my answer there is sure, you could eat a little bit more, but the most powerful stimulus to hang on to muscle, even when you're in a deep energy deficit, is to perform resistance exercise. Are protein supplements better than real food? I didn't give you any data here, but so this is my opinion, so I'll call it a weak signal. But if you look within the Morton meta-analysis, you'll notice that some of those studies use food and others use protein supplements. And it wasn't apparent to us when we did a subgroup analysis and called a remove one procedure, where we took out supplement groups or we took out food groups, that anything weakened that signal that we saw. So I don't think that that's the case. If you're judicious about how you plan your diet and you're getting all the other nutrients that you need, supplements are a great convenience, and that's, I think, where the advantage ends. Are some protein supplements better than others? And I think this sort of comes down to the vulnerability of the group that you're studying. So in older diseased patients and people who are anabolically resistant, ICU patients, for example, then quality may be important. In other words, giving an older patient in the ICU a collagen-based supplement is a huge disservice, because they really need to get a high leucine intake. For younger folks and people who are physically active, I don't think that there's any evidence that some protein supplements are better than others, so long as you're getting a sufficient dose of leucine. So very low leucine containing protein supplements, things like collagen, are definitely not worth the time. Will protein cause my kidneys to fail, my bones to dissolve? Hopefully we can sort of put that one to bed. It still keeps rearing its head every now and again, but I think that there's really no evidence to suggest that that's the case. And finally, in our hands at least, HMB does not, when compared to leucine, stimulate greater gains in muscle mass. And we came, to say that we failed to reproduce would be an understatement. We came nowhere close to those previous 3 studies. So, I don't know why anybody would expect that to be so much greater. It's a metabolite of leucine. It signals through the same canonical pathways. Why it will be so much better than leucine. But, so I think we've got to do some pretty good systematic meta-analyses on the studies that are out there. And if we fall back on those that are done to date, there's no evidence for HMB to be effective. So where are we going next with all of this? We want to understand the adaptation to resistance exercise. For that, we're going to require some very deep omic level analysis. Very difficult to do, difficult to standardize methods, but we definitely need to have methods that are comparable across large cohorts of individuals. One of the questions that's been raised and challenges a lot of the models that we put forward with respect to how resistance exercise works is the key nature of ribosomes and whether they are involved in the process. And that's one that we're collaborating with a number of labs to try and answer the question. And the last part relates to resistance exercise as a form of exercise that probably gets the short end of the stick with respect to maintaining health and definitely helping people as they grow older, compared to, for example, aerobic exercise. And I think it's important to emphasize that the bulk, and I mean, when I say bulk, I want to say about 95% of the literature in exercise physiology has been dedicated to understanding the effects of aerobic exercise and the influence then the cardiorespiratory fitness has on people's ability to live longer and healthier lives. So disease-free, if you like. And I would definitely agree with the data out there, and I would never say to not do something that could promote cardiorespiratory fitness. The evidence, however, now is accumulating to suggest that resistance exercise is not merely sort of the opposite to aerobic exercise, and in fact, done with enough intensity or frequency, or at least with enough, I would say, effort, that resistance exercise recapitulates in probably the vast majority of areas aerobic exercise with respect to its health benefits. It has some unique ones as well, because you don't get much stronger when you perform aerobic exercise. But the interesting point then would also be that it actually is probably a form of exercise that for some people may even be an easier thing to do. The problem for a lot of people is understanding the complexity of some of the formulations and permutations that are out there. Going for a walk or going for a run is a relatively easy thing from a prescriptive standpoint to tell people to do, but sets, reps, weight, that sort of thing, lifts, the order of lifts and everything complicates the prescription to people who don't have a background in resistance training. So we're trying to decomplicate some of that and show people that the prescription need not be complicated, and particularly in this time when probably a lot of us don't have access to free weights and a gym and everything. I think that it will be important to explain to people that, you know, a push-up, a body weight squat, something like that is actually pretty beneficial. So I want to thank everybody for taking the time. It's been a real pleasure. I can see the chat lighting up, and so hopefully we've got some time left over to answer a few questions.
Great, Stuart. Thank you very much. Really, really interesting as always. Talk. Thank you for that. And you're right, always stimulating. There's quite a few questions. I'm quite relieved that the Ninja Terrorist, that is my 3-year-old, only interrupted us once. But technology allowed me to mute that, and you didn't see any of that chaos that was unfolding behind.
Yeah.
Stuart. So number of questions. I think is where to start. I think you can see some, but I'm going to start with a question from Peter Watt, given that he was my PhD supervisor, and if I don't ask it, he might track me down and give me what for. So his question relates to protein type of meal before sleep, and does it affect the outcome? So in his question, he mentioned slow versus fast digest and absorption.
Yeah. Again, so this work is almost exclusively, I'd be talking about Luc Van Loon's lab, who has generated the data in this area. I don't know that it matters that much. I know that Luc's lab has used a lot of casein in the studies that they've done. The intrinsic sort of appeal of casein would be is that there's a slower digestion and then a slower release of amino acids that would last probably longer and into the night. That if it doesn't stimulate synthesis robustly, it would at least maybe suppress breakdown. I think that's a viable theory, and I would probably have to, defer to people like Jorn Tromelin and from Luc's lab and Luc himself to answer the question completely. My take is that the pragmatic message is that the protein might not matter as much as getting some protein, but it might depend then on who you are as an athlete. So if you were looking to climb on the podium, go to Tokyo, albeit next year now, maybe that's a big deal, but I think for most mere mortals, it's probably not a huge issue.
Thank you, Stuart. Hopefully that's answered your question, Peter. Related to that question, we've got one on pre-bed feeding, and I think you probably answered that earlier, but it may be different for prior sleep. But is there an opinion on how close it should be prior to sleep?
Yeah, look, this is one that again, when you talk to athletes about liking it or not liking it, or when they do it, so there's a little bit of a difference. So in North America, a lot of people eat their dinner or their supper, whatever you want to call it, at 6 o'clock. If you went to the Mediterranean region of Europe, or a lot of other places in Europe, then they eat much later in the day. And so I don't know that if you were eating your dinner time meal at say 9 o'clock at night and you're going to bed, hour or two later, then there's no need, I don't think, for this pre-bed feed. You just did it with the meal that you ingested. So for some people, it's I've heard, I get really hot. My sleep is disturbed. I don't like it. Lots of different things. And so I think it's a personal preference as to when that meal happens. And then some pragmatism around, if you just had a big dinner and, you're going to go to bed a few hours later, then this contrived meal probably isn't a big deal, I would think.
Thank you, Stu. Some other questions related to this one I think is quite important because I don't think I heard it, or maybe I missed it as well, but from Elizabeth. She asked about the age range for the older individuals. I know that's going to be different from study to study, but there's sort of a general consensus on that.
Yeah. So most of our studies, we don't say, I don't say when aging starts, but you know, this year aging starts at 56. Next year it's 57. Year after that it's 58. That's just a personal observation. But you know, my take is, you know, we test people when we do our older studies, 65 and older. The age tends to average out to be about 72, 70 to 72. And I think in those studies that I showed there, Keelan's study was 72-year-old men. Michaela's study was 68-year-old women. And we'd be honest in saying that those are relatively healthy older people. They're on the low medicated side. We eliminate a lot of medications, and so we're kind of choosy about who we take, just so they don't influence the outcome. We don't have a lot of data in the older old, so I think that's probably worth bearing in mind.
Great, thank you, Stuart. And on the back of that question from Eric Richter, obviously you know well, his question is probably related to how he sees me, but his question is, can anabolic resistance in older individuals be reversed with training? So can you increase sensitivity by remaining physically active?
Yeah, that's a great question. Look, I mean, I think when we've done studies in the past, we get some 75, even older, men and women that come in, and metabolically, you know, not a lot of them, but they're taking no medication. They have, you know, their blood pressure might be sort of grade 1 hypertensive, but it you know, wouldn't raise eyebrows. When we put a pedometer on them, though, they might be taking, you know, 15, 16,000 steps a day, or they're engaged in, you know, some form of habitual, mostly aerobic, but sometimes resistance exercise. And these individuals just metabolically look like, you know, 30-year-olds. It's you know, uncanny. They are still anabolically resistant. So there's something intrinsic to the aging process that they don't look exactly like 30-year-olds, but they look more like a 30-year-old than the average 60s, 70-year-old. So I think the answer is yes, partially, but like a lot of things, there's probably a program around aging per se that you just can't overcome. And even masters athletes, they look great, but there's some things that begin to set in that are just, you know, even the exercise at some point, and maybe you're just, you know, people say, you know, they're not doing enough, and you know, it's still relative to what you can do. That you can make it look better. I don't think it ever really goes away. So.
Great. Thank you, Stuart. So another question came in about women and men. Does that affect, so being female, does that affect the hypertrophy, and does that change with menstrual cycle?
Yeah, great question. Got to say right off the bat, we haven't done enough work in women. Needs to be more work done. We're looking to rectify that in the latest go round of some of the studies that we're planning. I'm going to fall back on a recent meta-analysis that was just published. The lead author is a guy named Greg Nuckols, came out in the Journal of Strength and Conditioning Research, and I think puts a bit of a nail in the coffin of, you know, hormones like testosterone drive anabolism, because the relative change in muscle mass between men and women that you see is actually about the same. So when boys become men, so puberty happens, that's when nature gives boys to men a natural anabolic advantage. But then after that, men and women sort of track each other so that they can still grow muscle, but it's relative to the amount of muscle that they had. So the intrinsic stimulus of the resistance exercise itself is not dependent on at least the testosterone milieu. There probably are some other confounding areas. So, you know, menstrual cycle, high estrogen, progesterone, et cetera, that we need to do a better job unraveling. And I know that there are some papers that have looked at menstrual cycle phase specific training related to the purported effects of estrogen versus progesterone. And my immediate answer is the literature in that area is confusing. So we need to unravel some of that. But great question, great point. Coming soon.
Thanks, Stuart. Just a time for a few more questions. Just conscious of time. Another question came in, similar type of question, but the different population. It's any takes on protein supplementation for athletic children? I thought that was quite a nice question.
Yeah. So I got 3 boys, right? So I was their coach at various phases of their athletic careers. Nobody is, going on to the NHL, which is the Canadian dream, the National Hockey League, or Olympic type athletes. But it's great. Probably some of my most enjoyable moments working with young athletes. They're always hungry for information. Young boys in particular want to be bigger. They want to look like their idols, and they want to. The thing I always tell them is that nature gave you the biggest boost that you can get, and that's growth and the transition through puberty as well, that you'll never recapture again in your life. Now, protein supplementation in that stage, I'm not a big fan. I'm a food first person. I think that the majority of things where younger athletes kind of trip up and miss out is actually in not planning their training. And then I've become a much bigger proponent over the last, I would say, probably decade or so, about trying to emphasize the need for adequate and good quality sleep, which I think has become more and more apparent to me as a detractor. In other words, young kids just don't get enough of it, and the quality that they do, because there's too many of these around, or computer games is just not good. So we try and get those things in line, and then we talk about diet, and we talk about foods that are sort of in the upper tier, middle tier, and then the lower tier is a lot of this sort of highly processed, value added stuff that kids tend to eat a lot of, which I don't think really gives you it definitely doesn't give you the nutrients that you need, and it's just empty energy. So I tend to stay away from protein supplements, because young kids just they tend to believe that that's a path, and supplements in general are this sort of special magic unlock, and I just think that that's there's nothing really out there that suggests that that's the case.
Great, thanks, Stuart. Just one more question, if that's okay, with you. So many questions to ask, but one that sort of struck me because I wasn't familiar with the HMB work. I wanted to know what, maybe I missed that when my son Avery came rushing into the room, but what is the mechanism? How is that actually working at the muscle level?
Yeah, I mean, that's my point. Is that the big thing with HMB is that you can get away with a small dose, right? So you notice it was 1.5 gram doses per day. So and the enzyme that humans lack to get it to the HMB state from leucine is a dioxygenase enzyme, but just sort of getting away from it. It signals through all the same pathways. There's really nothing that I don't think is particularly novel and is a property of HMB that's not a property of leucine. So its ability to suppress autophagy or any sort of proteolytic pathway on about the same I think scale is leucine. The difference is leucine is an amino acid involved in a lot of other metabolic fates other than HMB is pretty much, it's the end product metabolite. But humans have some HMB, just not very much of it. So it's not that it has it's not a pharmacologic, sort of hammer and nail. It's pushing on a receptor or antagonizing a receptor that leucine's not. So that's what sort of makes me think, I put my hands up and say, well, what's the advantage of it? Other than a lot of work that's been generated by initially the people that own the patent on the product, and subsequently Abbott, which took over EAS, which was the original supplement company, and now has HMB in a lot of its anti-sarcopenia aging formulations. So.
Great, Stuart. There are obviously quite a few more questions. If I don't leave soon, my wife will come and hunt me down. But just a few notes, some positive response from a few. Thank you, Stu. Great talk. And one for me, I think it says, "You look old, just saying." So thanks, Andy, for that nice positive
Andy who? I
response.
want to know Andy who, you know?
Yeah,
Oh, thanks, buddy.
yeah, yeah.
Awesome.
Thanks, Andy.
Look, I'll
Stu,
say this. I'll say this, Richard, is that probably most people know I do spend some time on Twitter, and if you want to put the questions on there, I can try and get back to them. You know, you said I thought I was busy before this all happened, and now like it's crazy. But I do like to hop on Twitter and interact with people, and so I'll try and answer questions that weren't asked or answered during this on there, or some other medium. I'd say email me, but that just gets lost. But I'm happy to try and hop on Twitter.
that's great. I can put the questions that people posed up on. I believe I can anyway, but don't come looking for me if I don't manage to do it when I get offline. And just to say that we've got some more talks coming. I know we had David James a couple of weeks ago. We've got John Hawley coming in next week around the same time, or maybe a morning slot. But have a look on Twitter. You know, obviously look on Twitter for Stuart and myself. And Eric Richter will be on the week after that. So some really big talks coming up. Stuart, thank you, as always, for being approachable and just being, you know, easy to approach and to offer talks. Very interesting talk as always, and I look forward to hopefully seeing you in person sometime soon, distant future. And I'm sure I can say for everyone involved who was listening tonight, a big thank you again. And so that I'll say good night to everyone, good afternoon to you, Stuart, and take care.
Awesome. Thanks very much for having me, Richard. Real pleasure. And thanks for everybody for tuning in.
Great. Take care.